you've been told your SI joint is out of place or that this is just sciatica, there's a good chance you've been chasing the wrong problem. If your pain is over the SI joint and refers to the back of your thigh, hurts when you walk, wakes you when you turn over in bed, or flares when you stand after sitting for a while, this pattern points to SI joint dysfunction and not a pinched nerve. In this video, I'll explain what's really causing your symptoms and why exercises, physical therapy, medications often don't provide lasting relief, and how correcting the underlying biomechanical dysfunction with precise chiropractic adjustments can help you get back to walking, sleeping, and moving comfortably again. I'll also demonstrate these chiropractic adjustments. And stay until the end because I'll reveal one of the most commonly overlooked causes of SI joint pain, and once it's identified, I'll show you why the solution is often much simpler than most people expect. Hi, I'm Dr. Whitney Wihlidal, a chiropractor in Orillia, Ontario. One of the biggest reasons SI joint pain is so frustrating is that it rarely behaves the way many people expect. Many people are told they have sciatica or a herniated disc or even a hip problem because the pain doesn't always stay over the joint itself. Instead, it often spreads into the buttock, the back of the thigh, up into the back, or even down towards the knee. And that can make it feel like a nerve problem, when in many cases the SI joint is the actual source. You may notice that standing up after sitting for a while is surprisingly painful, or that walking long distances can make one side of your lower back or pelvis ache more with every step. Rolling over in bed may wake you up with a sharp pain, and standing on one leg to get dressed can suddenly feel unstable or uncomfortable. These are all patterns I see regularly in people whose SI joint isn't moving the way it should. One of the most common things my patients tell me is, it feels like my hip keeps going out, or something just doesn't feel lined up. That description is important because it tells me we're often dealing with more than irritated muscles. It suggests the joint itself may not be functioning normally, which is causing the muscles and ligaments around the SI joint to work overtime just to keep it stable. The sacroiliac, right here, is one joint where the spine connects your pelvis to the entire body. It doesn't move very much, but these small movements are incredibly important. Every time you walk, climb stairs, bend over, or simply shift your weight from one leg to the other, the SI joint helps to transfer that force between your upper body and your legs. When one side isn't moving properly, it's become irritated. Every step can place abnormal stress through the pelvis, and that's often why the pain keeps returning instead of settling down. The challenge is that the SI joint dysfunction can look remarkably similar to other conditions, which is why it's so commonly overlooked. If the true source of your pain isn't identified, it's easy to spend months or even years treating the wrong structure. So how can you tell if the SI joint is actually the source of your pain? There's one simple thing that you can check at home that can provide a very useful clue, and that is what I'll show you next. Before I show you this, I want to be clear that this is not meant to diagnose SI joint dysfunction. Many conditions can cause pain in the same area, so if you're dealing with persistent symptoms, it's important to be evaluated by your medical doctor or chiropractor for an accurate diagnosis. One simple thing you can check is whether the SI joint itself is tender to touch. Start by finding the two bony bumps on the back of your pelvis just above your buttocks. These are called the posterior sacroiliac spines, or PSIS. From there, press firmly over and slightly inside that area where the SI joint sits, right through here. If pressing directly over one side reproduces the pain you've been experiencing, that's a strong clue that the SI joint may be the primary pain generator. It doesn't confirm the diagnosis on its own, but tenderness directly over the SI joint is one of the most consistent findings we look for during clinical examination. The next step is understanding why that joint has become painful in the first place. The SI joint is actually one of the most stable joints in the body. Unlike your shoulder or your hip, it isn't designed for large amounts of movement. In fact, the joint is naturally shaped to fit together almost like interlocking puzzle pieces between your sacrum, which is the base of your spine, and the pelvic bones. This natural stability is known as a form closure. On top of that, a network of very strong ligaments and the surrounding fascia coordinate contraction of the muscles around the pelvis, create what's known as force closure, providing even more stability during activities like walking, lifting, and standing. Problems develop when that stability is disrupted. Instead of the joint moving and transferring forces normally, the supporting tissues can become irritated, and the joint capsule and surrounding ligaments are especially sensitive to this. They can become inflamed and painful even with small amounts of abnormal movement. This is why people often have very specific tenderness directly over the SI joint and pain that refers to the buttock or down the back of the thigh, usually stopping above the knee. That referral pattern is one of the key differences between SI joint dysfunction and true sciatica, where pain is caused by compression or irritation of a nerve that goes down the lower back and down to the back of the leg and foot. Before patients ever come to the chiropractor, many people with SI joint pain dysfunction have already tried physiotherapy, home exercises, pain meds, or anti-inflammatory medications. Some have even tried treatments like cold laser therapy, shockwave therapy, massage, or acupuncture. And I want to be clear, there's absolutely a place for these treatments. They can help reduce pain, decrease inflammation, and make you feel a little more comfortable. The problem with these is that none of these therapies directly correct the underlying biomechanics of the SI joint itself. If the joint isn't moving properly or has become dysfunctional, treating the inflammation without addressing the source is a little like resetting a smoke alarm without putting out the fire. You may feel better for a while, but the irritation often returns because the reason it developed in the first place is still there. The same principle applies to medication. Pain relievers and anti-inflammatory medications can be very helpful for managing symptoms, especially during a painful flare-up, but they don't restore the normal SI joint function. Exercises are another important part of recovery, but timing matters. I frequently prescribe lower back and SI joint stabilizing exercises because they help strengthen the muscles that support the pelvis and improve the long-term stability. However, I prefer to introduce them after we've started correcting the SI joint dysfunction itself with specific chiropractic adjustments. Once the joint is moving more normally, these exercises become much more effective at helping maintain the correction rather than trying to compensate for a joint that still isn't functioning properly. If the underlying problem is that the SI joint isn't functioning properly, then the logical question is, how do we correct it? The goal of chiropractic adjustment is to restore normal motion and biomechanics to the joint. When the SI joint becomes restricted or dysfunctional, the surrounding ligaments, joint capsules, and muscles are placed under abnormal stress. Over time, that mechanical stress can continue to irritate the tissues every time you walk, bend, climb stairs, or simply stand on one leg. The chiropractic adjustment uses precise controlled force to help restore normal movement to the SI joint. Contrary to what many people may think, the goal isn't simply to put the joint back in place. The objective is to improve how the joint moves, reduce stress on the surrounding tissues, and allow the body's normal healing process to take over. Most patients notice that moving feels easier after the joint is functioning more normally because the irritation that's driving their pain has been reduced. And as inflammation decreases and movement improves, we can then build on that progress with exercises that strengthen the muscles supporting the pelvis, making the results more durable over time. Let me show you what that looks like. So as we explained, the SI joint is a very subtle movement. It's like two puzzle pieces moving together. So the movement is very small, and there's a joint on each side of the sacrum, between your ilium and the sacrum. Okay, so left and right SI joints. But again, they fit together rather tightly, and the movement is very subtle. So when we're adjusting the SI joint, we'll have done a full assessment where we do palpation, range of motion testing, posture assessment, reflexes, etc. And once we've determined that it is the SI joint, there are multiple ways that we can adjust it. The first way I'm going to show you is a manual adjustment. This is a very typical way of adjusting that people think of with chiropractors. And the way we do this is we'll have the patient sidelines. They're going to be facing towards me. And in this case, we're going to be adjusting the right SI joint, so the joint on the high side. So we'll position the patient in a way that the SI joint is isolated here for movement. And then we'll position the base of our hand on that ilium. And from here, once we lock out that one specific area, we can just deliver a quick thrust that will get that SI joint back into normal positioning and back into normal movement. So that's one way of adjusting the SI joint. The second way we can adjust is using the drop table. So I have that face down. The drop table is a common way of adjusting as well that many chiropractors will use. And what happens with the drop table is it pops up about 1/2 inch. So that we go to adjust, it'll drop away. This allows us to move that SI joint very quickly and restore the normal movement and alignment nice and easy. So in this case here, we'll set the drop so it pops up about 1/2 inch. We'll stabilize on the opposite side, use a thenar drop, and just do a quick drop through the SI joint. It sounds a little loud, but it's a very gentle way of adjusting the SI joint in almost anybody. The third and final way I'll show you that we can adjust is using an instrument like an impulse adjuster. There's multiple different kinds of these. What this does, it just delivers an impulse in a very focused manner. So again, once we've palpated and assessed the SI joint, we can use the impulse adjuster on the ilium and deliver a few small thrusts through that joint. Again, this is a very gentle and easy way to adjust. And in people with concerns with very sensitive or sore fascia and tissue around the SI joint, or people just, like I said, with very little movement there and you want to get more restoration of that movement, you can use an impulse adjuster. Now, as we're adjusting this, what often happens, or what often you will see, is misalignments and subluxation areas in the lower spine as well, maybe into the hip joints. So oftentimes we'll adjust other segments as well beyond the SI joint, but those are specifically how we would adjust the SI joint. But there's one important piece of the puzzle that often gets missed. Some people continue to have recurring SI joint dysfunction because there's an underlying biomechanical reason the joint keeps being overloaded in the first place. And one of the most common and most overlooked is an anatomical short leg, also known as a leg length discrepancy. When one leg is anatomically shorter than the other, the pelvis can no longer sit level. And as the pelvis tilts, the sacrum also becomes unlevel, creating abnormal loading where the sacrum meets the pelvis at the SI joint. Instead of forces being distributed evenly now, one SI joint is repeatedly compressed with every step you take. And over time, that extra stress irritates the joint capsule and ligaments, leading to ongoing inflammation, pain, and recurrent SI joint dysfunction. The effects don't stop there. An unlevel pelvis also increases stress on the L5-S1 disc, the lumbar facets, and creates additional sources of lower back pain and inflammation. As your body tries to compensate for those changes and alter your posture, where your feet, knees, hips, spine, shoulders, neck, and even the position of your head will be changed. Unfortunately, many healthcare providers and therapists aren't trained to evaluate anatomical leg length discrepancies as part of an SI joint assessment. It's a routine part of every examination we perform here, because if you don't identify the underlying biomechanical cause, the SI joint continues to become overloaded even after successful treatment. If I determine that an anatomical short leg is contributing to the problem, treatment involves more than just adjusting the SI joint. In addition to precise chiropractic adjustments, I'll prescribe custom measured foot lifts that are matched to each patient's specific leg length discrepancy analysis. These lifts don't simply make the legs feel more even, they help to level the pelvis and restore sacral base to a more balanced position and significantly reduce the abnormal forces being placed to the SI joint every time you stand and walk. I've created several videos on my channel that explain anatomical short legs, leg length discrepancies, and how I measure them in a much greater detail. If you'd like to learn more about this important topic, I'll link these videos in the description below. For many patients, this combination produces noticeable pain relief very quickly. More importantly, by correcting both the SI joint dysfunction and the underlying biomechanical imbalance, we're addressing the reason the problem keeps coming back. That's what gives many patients not only immediate improvement, but also longer lasting relief while helping to prevent recurrent SI joint pain in the future. Today we covered how to recognize the signs and symptoms of SI joint dysfunction, a simple self-check you can perform at home, and why treatments like medications, physiotherapy, and exercises don't always provide lasting relief, and how chiropractic adjustments can help restore normal SI joint function, and why an anatomical short leg is one of the most commonly overlooked causes of recurring SI joint pain. By identifying and correcting the underlying biomechanical cause, not just treating the symptoms, you have a much better chance of achieving lasting relief and getting back to walking, sitting, sleeping, and moving more comfortably again. If you found this video helpful, which part taught you something new? Was it the self-check for the SI joint tenderness, or learning about anatomical short legs and leg length discrepancies? Drop a comment below and let me know. If you found value in this video, please give it a like and share it with someone dealing with SI joint pain or lower back pain. Doing that helps more people find practical, non-surgical solutions that may help them move better and feel better. And be sure to subscribe if you want real solutions for pain relief, better posture, and a clear understanding of what's causing your symptoms, so you know exactly what to do next. Now, if you'd like to learn how a leg length discrepancy may contribute to low back pain and SI joint problems, go watch this video next. I'll show you why a short leg matter and how it affects your movement, and explain how we help patients move with better balance and less pain.